Sọ̀kalẹ̀ sórí mi, ó sọ̀kalẹ̀ sáyà mi, ó sọ̀kalẹ̀ síkùn mi, ó sọ̀kalẹ̀ sọ́kàn mi. Good afternoon, everyone. Good afternoon, good evening. Welcome to another edition of Health Talk with Mutiat. Hi, my name is Mutiat. How are you doing? How's your week going? Sorry, today is on a different day as per our work schedule. My work schedule this week is a little funky. So we're going to get right to it. All right. So today we shall be talking about prostate cancer. Prostate cancer is one of the most common cancers men get, and I feel it's something we should talk about, or you should know about, so at least it doesn't catch you unawares. Okay, so first of all, what is your prostate? Most men, I'm not sure if you guys know what your prostate is, or where your prostate is, or what is a prostate, but I think it's something you should know. It's part of your body, all right? It is part of your reproductive system, okay? It is about the size of like a orogbo, like a size of a walnut. That's what your prostate, that's the size of it, all right? I always have pictures, all right? Your prostate is right here. See the bladder, your prostate is right there, okay? And it's like right around your urethra, the tube that carries urine from your bladder into your wee-wee and goes out. So that's what your prostate is right there. Yeah, that's your prostate, okay? All right, so what does prostate do? What does your prostate do? The main job of the prostate is to provide fluid for semen. Now, when the semen is made by the testicle, the sperm is made, by the testicle, it goes and it reserves until you actually need it. So how it flows is a job, the liquid that it flows in is the job of the prostate to produce. So that's what the job of a prostate is to produce fluid that help your sperm go out and create babies or whatnot that's used for. All right, so why are we talking about prostate cancer? Why is this something that we talk about? Because one in 7 men are diagnosed with prostate cancer. All right. I mean, as much as it's not 1 in 7 men is diagnosed, and it's not one disease that we actually see. We do see a lot of it, but it's mostly in the older gentlemen. We see mostly in men over age 60. That's pretty much when it's diagnosed. All right. However, we need to stop knowing our body before age 60 and before we get diagnosis of prostate cancer. That is why we're talking about this today. All right. Like I said, 6 to 10 cases are diagnosed in men in 65 and older, and it's quite rare to have prostate cancer when you're below 40. I didn't say it's impossible. I said it's quite rare. So God forbid, you might be one out of the million that may get prostate cancer. So please, pay attention and at least understand what's going on with your body. All right. So prostate cancer is a serious disease, okay? If it's not caught on time, it can wreak a lot of damage. It can cause a lot of damage to a man's body, all right? Only men have prostate. Let me just put it out there just in case some women are thinking about it. It's only men. Women do not have prostate cancer. Women do not have prostate issues. So we're just going to let it go right there. Only men. I'm doing this topic because last week the men felt I was a little biased talking only about breast cancer to women. But the thing is, men do have breast cancer also. So it's actually joint men and women that that breast cancer applies to. But I am pacifying my men. I'm not only talking about women, I'm also talking about men. That's where we have prostate cancer today. That's why we're discussing this topic today. All right, like I said, prostate cancer is it's a serious disease, okay? If not caught early, it can wreak a lot of damage to a body. All right. So, what are the risk factors? All right. Risk factors number 1 is that you are the older you get. Age is a risk factor for the older you get, the more chances of you getting prostate cancer. All right, older, like age 60 and above, age 50 and above, that's when you have a higher risk of having prostate cancer. Your race, unfortunately, again, it is more predominant in us, black people, Nigerian people, African American people. It is more predominant that we do have prostate, that our men do have prostate CA. All right. Family genes. If your family, anybody in your family has had any form of cancer, again, this increases your chances of you getting cancer. It doesn't mean you're going to get it. It just increases your chances of you getting cancer. So if anyone in your family, especially immediate family, your dad, your mom, your brother, your sister, your aunt, your first aunt, or somebody like that has had some form of cancer, there's a good chance you might have some form of cancer also. So that also increases your risk for having prostate cancer. All right. Smoking. Here again. Smoking. I've had 4 of these videos done, and each one of them has had smoking as a risk for causing something. So if you smoke, I beg you, my brother, I beg you, my sister, I beg, quit. It is wreaking a lot more in your body than you know about. So if you are smoking, I beg you, please quit smoking. It is not good for your health. At no point has smoking done any good for anybody else. And as the common slang, who's smoking help? If smoking, why would you be smoking? It does a lot of damage for your body. All right. So the risk that it's out there that we're not sure can cause prostate cancer is diet, obesity, if you're a little bit heavier, chemical exposures, STDs, inflammation of the prostate. We're not sure if this can cause, but at the same point, they're still looking at it to see if it can cause any form of cancer. All right. All right, so as any form of cancer, do we know any cause? Do we know the cause of prostate cancer? No, we do not. Unfortunately, we do not. It's not been pinpointed yet that this causes cancer, this causes cancer. I think yesterday on my phone, I got another chain, or if you put something here, do not eat something there, that's known to cause cancer. Unfortunately, there's no known cause of cancer. Yes, we're still saying, okay, maybe if we do this different, maybe if we do that different, we might not get cancer. That's all we're doing right now is trial and error to see if this works or if it doesn't work. But as of I know, has not been out yet. I still checked with the American Cancer Society. I still checked in all my research books and all that good stuff. There is no known cause for cancer. All right. So if anybody's telling you this causes cancer, my brother, my sister, I'm begging you, please do not fall for that. There's no solid cause for cancer. All right. So it's now that we don't know the cause, can prostate cancer be prevented? No, because if we don't know the cause, how can we prevent it? So we don't. All right. So what are the signs and symptoms? What should you be looking out for prostate cancer? What should you be looking out for to direct you to your doctor, to send you to your doctor? During the early times of prostate cancer, there is no signs. There are no signs, there are no symptoms. However, the longer it prolongs in your body, you do have like pain. You have pain in the lower back of your lower back, in your pelvis. You have frequent urination. Now, frequent urination is one of the tricky signs because also it can mean BPH, which is enlarged prostate. All right, so it can mean that, but because you're peeing a lot doesn't mean that you have prostate cancer. It just means something is wrong. And when I say peeing a lot, you have the fullness that you want to pee. You pee like a little drop, and then you have to go back again. So it's like you feel like you're not completely peeing. So that is a sign that you want to talk to your doctor about. All right. Like I said, if you have any trouble peeing, weak flow, if you notice blood in your urine or blood in your semen or your sperm, you want to let your doctor know. Okay, that's a sign that something is wrong. Anywhere you see blood that there shouldn't be blood, you want to let your doctor know. Okay. All right. Painful ejaculation for men when you're having sex. When you're ejaculating, the pain is intense. It's not the pleasure or whatnot. It is pain. So if you have painful ejaculation, you want to talk to your doctor. Let them know something is going wrong. If you're losing weight without dieting, without trying to lose weight, you want to let your doctor know. If you have loss of appetite, if you're not eating as well as you normally do, you also want to let your doctor know. All right. And if you have pain in your bones, especially in your back, you want to let your doctor know. All right. Because when prostate cancer is not caught in time, the first place it goes is to your spine. We don't want that to happen. That's where the bone pain is coming from. Okay. So how do we screen prostate? How do we screen prostate cancer? How do we screen for it? All right. The first thing most doctors do is called a PSA. It's a prostate specific antigen. It's a blood work that you would do. Your doctor will do it, and then based on the result, they'll let you know what's going on. Now, anything below a 4 is good. Anything above a 4, you and your doctor want to talk about it, because there's some things that will increase your PSA. Things like inflammation of your prostate. If you have prostate infection, if you have any kind of inflammation, if something is wrong with your prostate, it may not be cancer, but that will raise your prostate specific antigen. That will raise the blood work. Okay, so don't fret. Once you get that result, let your doctor interpret it for you. Sometimes you're just dehydrated. They will raise that. All right. Also, digital exams. All right. When you go to your doctor when you're age 40 or age 35, if you have any comorbidities, or if you have anything like your family has had some kind of cancer, once you go to the doctor, all right, they will do a digital rectal exam. I know most guys don't like that because it's a little bit, a little bit painful, a little bit uncomfortable. But hey, it's all of 2 seconds. Okay, 2 minutes. It tells all of 2 minutes. And see, I have no nails. Don't worry. If you come to me, I won't hurt because I have no nails. All right. So it takes all of 2 minutes. Your doctor will go in there, feel around, make sure there's no lumps, there's nothing there. Like women too, we do our breast, monthly. You men too, at least you go in and they do the check just to make sure that there's nothing going on. There's no lumps, there's no bugginess. It's not too soft, it's not too hard. They don't feel any like little nodules of it. So that's one thing. That's a digital exam that you might do. All right. So when should we screen ourselves? When should our men screen ourselves for prostate cancer? We do that. Men should do that age 35 and above. All right. If you have any familial history of any form of cancer, and you talk to your doctor, the doctor might want to start it at 35 and above, or 40 and above. If you're African American or Black or Nigerian or whatnot, you want to start it at age 40 and above. Let your doctor go see your doctor. Even if they don't do a PSA, they might just do a digital exam just to make sure that everything is going well. All right. So once this is done, pretty much like every year. Or every year or every 2 years, depending on your risk. So you should always go see your doctor. At least I always advocate, please, we need to be more proactive with our health. So we need to go see our doctors. I know it's a little expensive. I understand that. But the same point is, this is your health. You only get one life to live. And if you ruin it or you don't take care of your body, most doctors cannot help you once everything is far gone. Okay? All right, cool. So how is it diagnosed? How is prostate cancer diagnosed? It's the true form, like breast cancer, it is diagnosed by biopsy only. All right, only by biopsy only. So that's the easiest way, the quickest way to diagnose prostate cancer is by biopsy only. A biopsy, again, if you remember, is when we take a needle and we take it into the node, the nodule, or whatever they find in there, and they look at it under a microscope, and it tells you whether or not it's cancer or not. If it's not, it is not. If it is, it is. Sometimes they will find nodules on any part of your body. It doesn't necessarily mean it's cancer. All right. Once they find the nodule in your body, they'll take it out and they will look at what it is. And sometimes it's just a plain nodule. It could be fat tissue. It could be a cyst. It could be whatever it is. But do not fret until we get the result back that it is, positive. And hopefully God willing, it is always negative. All right. So, how do we treat it? Prostate cancer is one of the slowest growing cancer ever. Okay, let me rephrase it. Yeah, it's one of the slowest growing cancer. But once we know it's there, it's good. Your doctor will monitor it. One of the treatment they do is just to watch for waiting. Most doctors don't do that anymore, but just in case you find one of the old school doctors and just want to watch your cancer and they want to watch it grow, then it is true. All right, they can just do that. Sometimes they will go in and they will do a radical prostatectomy. What that is they actually take out your whole prostate, depending on how far gone your prostate is or where it is placed. All right. So also they can do radiation, they can do chemotherapy. That's a treatment for it. Depending on where your cancer is or how far they think it's going to radiate, then they will do that. All right. Also, they go in and they freeze it. Again, like I said, it's one of the most slow, it's one of the slowest cancers growing. All right. So I can tell what most people say, most doctors say is, if a man at age 70 is diagnosed with prostate cancer, they can promise you it is not the prostate cancer that will kill you. It's not the prostate cancer. We can promise you that. All right. We can promise that it's probably going to be something else, because it's so slow growing. It's so slow growing that it doesn't really affect too much. But it is good to know, because God forbid you're without one person that get the fastest growing cancer. So it's something good to know. It's something good to watch and understand that, okay, this is my risk. This is what I need to do to prevent myself from, to make sure and try and ensure that I'm doing everything possible to make sure my body's healthy. And if I do have prostate CA, there's treatments. If you with any form of CA, with any form of cancer, early detection is key. Early detection is key. If it's caught early, there's so many things we can do that you will not end up. It won't go too far. However, if you wait too late, if you start seeing some symptoms, or if you notice your body, something is wrong with your body and you're not doing well with it, you don't go to the doctor. You stay at home and self-medicate. Once it goes too far, at that point, I'm not sure what can be done. So at the end of this, I don't have much to say about prostate cancer. It's more of a FYI for my men. Please, and women, you have husbands, please ensure that they do go see their doctors, and they do the testing every year, or follow up if something is found. It is very, very important that we take care of our health. It's health promotion is very, very important to us. We shouldn't wait till we are ill, or we shouldn't wait till we are completely ill to go see our doctors. All right. As usual, if you have any questions, please contact me. Feel free to inbox me or send me an email, mutsan23@yahoo.com, mutsan@23@yahoo.com, or feel free to inbox me. It's always great talking to you. This is a very, very short. This is a very, very short class. It's a very, very short lesson. Feel free to share also. This is for the men. Don't let us be biased, only sharing for women. Also share for men, because we never know where this information is going to lead, and also it's good to know. All right. Thank you so much for letting me come to your homes. Thank you for letting me come to your house, to your cell phones, and thank you for listening to me babble on. Thank you. It's been a great day. Enjoy the rest of your day. Bye bye.